Yes, please come in. And I would like you to start this lecture so that we can enjoy the evening cultural program after this.
Can we off the light?
Oh, that's a big thing.
Oh, that's a big thing. So we can keep it on, look off.
No, I'll tell them. They have to go outside somewhere to do all this.
Anyway, we can start, yeah.
You can start it here.
Okay.
Look
Yes.
at the lighting.
Just wait for a while for colleagues to come in.
Yes, because the lecture just got over.
Just over, that's right.
Because it started late.
So I must warn you.
Light bunker.
This is the most boring lecture I'll ever. So if you don't fall asleep, I think there will be a
No, we are fully awake.
But if I'm able to at least trigger your thinking, I think there will be a successful.
Yeah.
Okay? So we're going to talk about a very boring topic called dermatophytosis. Nothing fancy here. Everyone has seen, diagnosed, but I think it will be a wonderful thing if I can somehow trigger something. Yeah? So basically, dermatophytosis is a fungal infection that is caused by fungus that is attracted to keratinized skin structure. So this fungus really like keratin. Keratin is in your hair, keratin is in your nails, keratin is on your skin. So what is there in keratin? Keratin, it has amino acids that is linked by disulfide bonds. So these fungus, because they cannot produce their own protein, they have to digest the protein in the hair so that they can live and be healthy. Okay? So these are a bunch of up to 30 dermatophytes in the world that infects humans, infects animals, and out of dermatophytes, there are some that have special characteristics. Some is found on animals, some is found on the ground, and some is found on humans. Yeah? But ultimately, no dermatophytes are naturally found on a healthy individual. So that means if we see a dermatophyte in an animal, it is unnatural, we have to treat it. Okay? But out of these 30 dermatophytes, we were going to be talking about the three major ones that you are going to see in your clinical practice. The most famous of them all will be your microsporum canis. The second one, you may have seen this perhaps in animals that has very close contact with rodents. So you have your Trichophyton metaphytis. And if you remember, long time ago, you may have heard of Microsporum gypsum. So this has changed the name to Nanissia gypsea. So what happened in the world of fungi is actually not lots of fun in fungi. It's quite boring. But rather, in recent years, they have developed a lot of PCR techniques, and they found that, hey, it looks like microsporum, but in terms of the genetic components, it does not really jive with the microsporum. So there's a lot of reclassification in the world of fungi. So right now, the world of fungi, I'm sorry to say, not very fun. So obviously, these dermatophytes can cause a plethora of clinical manifestation. For those in clinical practice, I think the most common that you're going to see is in the cats, whereby they have this typical dermatophytosis in cats. And in the dog, you have a type of condition whereby the fungal structure attacks the dermis. So you see a fungal carrion seen only in the dog. Okay? And if the cat is very unfortunate, especially if the cat is a Persian or a Persian cross, the breed of Persians, they have a genetic disability whereby, if very unfortunate, the fungus can actually grow into the dermis, and in this case, it causes mycotic pseudomycetoma. So it's a deep fungal infection. Yeah. So 3 manifestations of this disease that you should be aware of, but optimally, this will be the most common one. Now, the name is called Microsporum canis, but actually it should be not known as Microsporum canis because this fungus is adapted to live on the cat. So in a perfect equilibrium, the cat is asymptomatic. So you see a cat that is healthy, but just that it has all these patches of baldness is because this fungus has reached complete equilibrium with the host immune system. It exists on the cat, but it does not trigger an inflammatory response. So this is a pure symbiotic relationship. Obviously, this dermatophytosis is seen commonly in young puppies and kittens, and especially in dogs that roam outside and hunting individuals. Because if you read those textbooks, those hunting dogs with their nose on the ground, it's going to attract the fungus that is geophilic. Okay? And geophilic fungus, it will be your Nanissia gypsea. Okay? It likes warm geographic regions such as India, Malaysia, and Singapore. And like I said, there are certain breeds that is very famous to get dermatophytosis. Persian is one of them. The second one in the picture here is a Yorkshire Terrier. And in the Yorkshire Terrier, if they get it quite nasty. Okay? And what we're going to see essentially is an asymmetrical lesions. That means the left lesions on the left side of the body don't look at the right side. That primarily targets the face, targets the ears, and then from the face, it transmits to the rest of the body. The reason being because as puppies, as kittens, that's how they suckle with the mother. When they suckle on the milk of the mother's fungus will pass to the face, and then from the face it goes to the rest of the body. Okay? And why are we looking at different types of patterns? That's why some of us may get a bit confused. Is this fungus or is it not? Because ultimately, the clinical manifestation of the disease is a complex interplay between a fungus that wants to exist on the body as a symbiosis against an immune response that is trying to get it out. So different animals will have different immune response, and you will see a different variation of inflammation. So that's why this diagnosis can be very simple, but it can also be very tricky. So we have the typical manifestation will be a dog that has all this circular lesion. But I must tell you, if a dog that with circular lesions like this, your first differential is not dermatophytosis. Your first differential should be a bacterial folliculitis. Okay? Alopecia. Crust. So this is a puppy, as you can see, that likes to play in the soil. Okay? So not just this puppy, but the entire litter has this problem. And when we culture, we got Nanissia gypsea, which is the fungus that is on the soil. So it's important, which later we will discuss, the importance of fungal culture. Because if you treat this puppy, yes, the treatment is going to be the same, itraconazole, terbinafine, or whatever that you use. Disease, the skin, this is how the skin reacts, right? It just turns dark, and then it will turn light again. And very rarely, you will see onychomycosis, whereby the nail itself is infected. This is very rare. The reason being, like I told you, different fungus disease, the skin, this is how the skin reacts, right? It just turns dark, and then it will turn light again. And very rarely, you will see onychomycosis, whereby the nail itself is infected. This is very rare. The reason being, like I told you, different fungus at specific wavelength, it agitates the photons, and then it produces a particular apple color green sheen. Okay, and Microsporum canis. Okay, let's get this right now. We have 3 species that can cause fluorescent in the 3 species of dermatophytes that can cause dermatophytosis in the dog and cat. You have the M. canis, you have the Trichophyton mentagrophytis, and you have your Nanissia gypsia. Only Microsporum canis will show the light. Okay? So out of 3 species that could infect the dog and cat, only 1. So if you depend on the woods light, and this dog has Nanissia gypsia, you ain't gonna get one. You're not gonna get the diagnosis. Okay, so it's the limitations of the woods light. Okay? And when you shine, a lot of vets get this wrong. Oh, something shines on the skin, voila, I got the diagnosis. But actually what you're looking for is the hair shaft is the one that should be lighted up like that. Can you appreciate that? It's not those things on the skin. We are looking at on the hair. Okay? So you take a wood's light, you shine it, and it comes up with a fluorescent color like that. The next thing you're going to do is that you're going to collect some samples with this hair that has shine positive. You're going to look under the microscope, and this is what you're going to find. You're going to see that this fungus, you can still see the hyphae here, and it produces a lot of arthrospores, which is how the fungus propagate. Okay, and these are all the arthrospores that is being shed. So this is actually positive for dermatophytosis. Obviously, we do not know what species it is. Obviously, with a positive woods light, most likely it's a Microsporum canis. Okay. So the crux of the story is, if an animal, if you don't use the woods light to shine, you simply just pluck the hair and look for this, best of luck to you. Because there are millions of hairs on the dog. What make you think you're going to be lucky to get the one that shines and you're going to get this?
Yes.
Right? So you have to be a bit intelligent in this. Please plan it, okay? Look for the fluorescent, pluck from these guys, and you'll get your diagnosis in 5 minutes or maybe less. Third way, which is the gold standard for me, is the fungal culture. And I do not know how it is done here in India. Do you culture it yourself? Do you send it out to the university or a lab? But if you do send it out to a lab, you must know that, for example, a cat comes to you in the morning, tomorrow morning. You take a brush or you cut the hair or whatever, you sample it. The sample is collected tomorrow morning and is cultured tomorrow afternoon. If it's more than 24 hours, the recovery rate drops very quickly. The reason being is because this fungus is going to get eaten up by other fungus or bacteria. So the recovery rate, if you culture it after 24 hours, is going to be very low. So sometimes that means if it's not planned correctly, your fungal culture, you are saying to yourself, God damn it, it was positive on woods, it was positive on trichogram, but why can't I culture it? So it's the instances, okay, that you find. But if you do collect it, this is what it looks like. I like to grow this fungus and I like to appreciate the beauty. And if you start culturing it, I suggest that you smell it as well. Different fungus will have different smell. Just like every man here, different smell. And some, they have a very sweet flavor, the scent, and some has a musky tone. Very interesting fungus. Huh? So here we have Microsporum canis. Just remember, it looks like hair. Do you think it looks like hair here? Fur-like. That is the term that is used.